Yeah, please. Someone can brief me what we have discussed yesterday. Ma? No, please. See, this whatever we are discussing. If you can give me a feedback. If you can give me a feedback, it would be much better for us to go to further topics. Okay. So we were discussing about the circulatory system of heart yesterday. What we are discussing? Circulatory system of heart. So in the circulatory system of heart, yesterday class we have discussed what was the structure of heart. We have discussed what was the structure of heart. Followed by we have seen what are the relations of heart. What will be their inferior, what will be their superior, what will be their lateral, what will be their anterior, and what will be their posterior. And followed by what we have seen? We have seen the external structure of heart. We have seen what, ma? External structure of heart. We have seen external structure of heart. Now, in this chapter, and yesterday we have also discussed the layers of heart. Yesterday we have also discussed the layers of heart. Now, in this chapter, we have finished what are the chambers of heart. Yes or no? Yes, sir. How many chambers of heart that fit up? Four chambers. So, back to back. Go to back. Yes, please. Move further. Inka. Back, Amma. Yeah, please. Go on. Yeah, leave it like. Come, yeah. You can see this particular diagram. Now, yesterday, quick recap I'm trying to give you. How many chambers are there in a heart? 4 chambers. How many? 4 chambers. What was this? What was this? What was this? What was this? So you know how many chambers are there in the? 4 chambers. Now, how many valves are there in the heart? 4. How many valves? 4. So right side is? Please. Right side is? And the other valve is? Pulmonary. So those are the 2 valves which are present on the right side of the. What are the valves that are present on the left side of the? Bicuspid valve. Aortic. Yes or no? Yes, sir. So how many valves does a heart have? Means we have 4 valves. We have how many valves? 4 valves. So they act as a gateway to the blood. They allow the blood passage from highest point to the lowest. Nothing but from right atrium, they allow the blood passage to the right ventricle, and they prevent regurgitation of blood into the right atrium again. They prevent what, ma? Regurgitation of. Same with the aortic valve, same with the pulmonary semilunar valve. Same with the pulmonary semilunar. Am I clear? Yes, sir. Am I clear? Yes, sir. Now we have discussed what are the openings of right atrium. Yeah, we have superior vena cava, inferior vena cava, superior vena cava, coronary sinus. These are the 3 openings which are present in the right atrium. Now, right atrium receives blood from which parts of the body? Yeah. From superior vena cava? Upper part of the body? Yes or no? Yes, sir. So now coronary sinus. What is this coronary sinus? 1%. It brings deoxygenated blood from the heart. Am I clear? Yes, sir. Now from right atrium, where the blood is going? Right. It is going to right ventricle. From right ventricle, where the blood is going? It is going to lungs. It is going to lungs. Now which blood vessel is carrying? Pulmonary artery. Now even though it is carrying deoxygenated blood, why we are calling it as an artery? It is carrying blood away from the heart. You get my point?
Yes,
Now,
sir.
when we have also discussed the structure of an artery and a structure of a
Vein.
yes or no?
Yes, sir.
We have discussed structure of an artery and structure of a
Vein.
Now, what is the structure of an artery? What is the structure of a vein? One person.
Veins contains large muscle and arteries contain large muscle and veins contain small muscle.
Yeah, one point is arteries contain
Large muscle.
large muscle and veins contain small smooth muscle. That is one point. What is the major difference? One person.
Arteries does not contain valves, veins contains valve.
Arteries does not contain any kind of valves in it, but veins have special type of valves. Veins have special type of valves. What is the lumen? Lumen. Arteries. Lumen is arteries. Lumen is small. In arteries, lumen is small. In veins, lumen is large. We have discussed. Yes or no? Yes or no?
Yes, sir.
This was the yesterday recap. Quick recap. So, what is the function of left ventricle here? From where it is receiving the blood? Sorry, left atrium. Where it is receiving the blood? From the From the Now, how many veins are bringing the blood?
4 veins.
4 veins are bringing the blood. How many veins, ma'am?
4 veins.
Am I clear?
Yes, sir.
Am I clear?
Yes, sir.
Now, from left atrium, where the blood is going on? It is going to the left ventricle. It is going to the
Left ventricle.
From left ventricle, the blood is distributed to all parts of the body. Which blood vessel? Archa. This is called as systemic circulation. This is called as what, ma'am?
Systemic circulation.
Did you get my point?
Yes, sir.
Did you get my point?
Yes, sir.
Now, in this chapter, we are going to discuss about the conducting system of heart. Slides, please. We have to discuss about the conducting system of heart. Come on. Please go on. Belum. Yeah. Back. Pick up, back. So, when we are discussing the conducting system of heart, now, so cardiac conduction system is a network of specialized cardiac muscle fibers. You can check out your textbooks also. Okay. You can check down your textbooks, okay? I will go line by line so that you can understand easily. Do you get my point? Yeah, please listen. Cardiac conducting system is a network of specialized cardiac muscle fibers. It's a network of what, ma? Specialized cardiac muscle fiber. They provide path for each cycle of cardiac excitation to progress through heart. So, the cardiac muscle, what it is doing, it is providing excitation to the muscle. It is providing excitation to the muscle so that the cardiac cycle is completed. Now listen to me. The conducting system ensures that the cardiac chambers become stimulated to contract in a coordinated manner. What is this doing here? This conducting system is sending impulse to the heart muscle. It's sending impulse to the heart muscle, and it is making sure that each part of the heart is contracting in a coordinated manner. Do you get my point? Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
No. Which makes the heart an effective pump. So what it is doing? The conducting system of heart, it is making the heart to contract so that the heart is pumping blood to lungs and other parts of the body. Lungs and other parts of the body. Do you get my point? Yes or no?
Yes, sir.
Yes. Here, conductivity is the property by which the rhythmic electrical impulses generated and conducted throughout the heart, causing rhythmic contraction of myocardium. So yesterday we have seen the layers of heart.
Yes.
We have seen it or not?
Yes.
So we have epicardium, we have myocardium, we have endocardium. So here the contraction stays in the myocardium. So what is happening here in the conductive system of heart? समझ में आ रहा है? हाँ समझ में आ रहा है ना? सुनो, conductive system of heart, यहाँ पे क्या हो रहा है? मतलब एक करंट जो पास होना है पूरा हार्ट की तरफ से, एक करंट कैसे जाते हैं? कोऑर्डिनेटेड मैनर, मतलब एक जगह पे कॉन्ट्रैक्शन हो रहा है तो और एक जगह पे रिलैक्सेशन होना है, एक जगह से दूसरी जगह जाने की तक थोड़ी टाइम लगती, थोड़ी समय लगती है वहां पे। सो यहाँ पे क्या हो रहा है? वो समय में अगर एट्रियम कॉन्ट्रैक्ट हो रहा है तो खून कहां से कहां तक आ रहा है? एट्रियम से वेंट्रिकल्स में आ रहा है। जब वेंट्रिकल्स कॉन्ट्रैक्ट होते हैं, राइट वेंट्रिकल से खून लंग की तरफ जा रहा है, लेफ्ट वेंट्रिकल से खून पूरा बॉडी की तरफ जा रहा है। వినండమ్మా, కండక్టివ్ సిస్టమ్ ఆఫ్ హార్ట్ అంటే ఏంటంటే ఇది ఎలక్ట్రికల్ ఇంపల్స్ ని మజిల్ నుంచి తీసుకెళ్తుంది. ఎక్కడి నుంచి తీసుకెళ్తుంది? మజిల్. ఇది సెలెక్ట్ చేసుకున్న మజిల్ ఏంటంటే మయోకార్డియం, మిడిల్ లేయర్ ఆఫ్ ది హార్ట్. ఏంటది? మయోకార్డియం. ఇదేంటి? మిడిల్ లేయర్ ఆఫ్ ది హార్ట్. సో ఇక్కడ ఏం జరుగుతుందంటే ఇంపల్స్ అనేది ఒక చోట ప్రొడ్యూస్ అయ్యి మరొక చోటకి ట్రావెల్ చేస్తుంది. ఏమవుతుందమ్మా? ఒక చోట ఏ అనే పాయింట్ దగ్గర ప్రొడ్యూస్ అయ్యి బి అనే పాయింట్ దగ్గర ప్రొడ్యూస్ అయ్యి సి అనే పాయింట్, సి నుంచి డి కి వెళ్తుంది. ఈ క్రమంలో ఏట్రియా దగ్గర ఇంపల్స్ ఉన్నప్పుడు వెంట్రికల్ దగ్గర ఇంపల్స్ పాస్ అవడానికి కొంచెం టైం పడుతుంది. సో ఏట్రియా దగ్గర ఇంపల్స్ ఉంటే ఏమవుతుంది? ఏట్రియా కాంట్రాక్ట్ అవుతుంది. వెంట్రికల్స్ దగ్గర ఇంపల్స్ వస్తే వెంట్రికల్ కాంట్రాక్ట్. ఈ లోపల వెంట్రికల్స్ కాంట్రాక్ట్ అయితే ఏట్రియం రిలాక్స్ అవుతుంది, ఏట్రియం కాంట్రాక్ట్ అయితే వెంట్రికల్స్ రిలాక్స్ అవుతుంది. అర్థమవుతుందా? సో ఇది కండక్టివ్ సిస్టమ్ ఆఫ్ హార్ట్. సో మనం ఇన్ డీటెయిల్ గా చూద్దాం కండక్టివ్ సిస్టమ్ ఆఫ్ హార్ట్. ఓకే, నౌ వెళ్ళాము నెక్స్ట్ పిక్చర్ వెళ్ళాము ఇంకా వినండి. సో లిసన్, యూ కెన్ సీ హియర్. So here we have different parts. So heart is clearly seen here. This one we are saying as right atrium, this one we are saying as left atrium, and this one we are saying as right ventricle, and this one we are saying as left ventricle. Yes or no?
Yes sir.
Yes or no?
Yes sir.
Yes or no?
Yes sir.
Listen carefully. Now, at what point the impulse is being produced in the heart? What is the exact place where the impulse starts? Okay, कहाँ पे शुरू हो रहा है? कहाँ पे? ఓకే, ఎక్కడ మొదలవుతుంది? ఏంటమ్మా? ఎక్కడ మొదలవుతుంది? ఏంటి కండక్టివ్ సిస్టమ్ ఆఫ్ హార్ట్ లో ఫస్ట్ ఎక్కడి నుంచి అయినా ఏం కావాలి? మనకి స్టార్టింగ్ పాయింట్ అనేది కావాలి కదా. अभी किसी के बारे में जानना है तो हमको पहले स्टार्टिंग पॉइंट क्या है वो जानना है कि नहीं? यहाँ पे स्टार्टिंग पॉइंट जो है वो कहाँ रहते? एट्रियम में रहते. कहाँ रहते? वो राइट एट्रियम में रहते. कहाँ रहते? राइट एट्रियम. सो यहाँ पे ये राइट एट्रियम में इसको हम क्या कहते हैं? मतलब यहाँ पे हमको सुपीरियर वेना का दिख रहा है ना? इसका नीचे रहते, इधर इसका नीचे सामने रहते. సుపీరియర్ వెనక ఉంది కదమ్మా, దాని కిందనే కొంచెం పక్కకు కనపడుతుంది. కనపడుతుంది ఇక్కడ? దిస్ పాయింట్ వాట్ ఎవర్ యు ఆర్ సీయింగ్ హియర్. ఓకే, దిస్ ఈజ్ నోన్ యాజ్ సైనోఏట్రియల్ నోడ్. This is known as
Sinoatrial node.
So the impulse is starting in the right atrium. Where it is starting?
Right atrium.
Just beneath the superior vena cava. Just beneath the
Superior vena cava.
And this part is known as sinoatrial node. Sinoatrial
node
is known as what, ma?
Sinoatrial node.
Are you clear?
Yes sir.
So that's it. Now क्यों यहाँ पे इंपल्स जो शुरू हो रहा है ना, इसको हम क्या कहते हैं? मतलब पेस मेकर कहते हैं. क्या कहते हैं?
Pacemaker.
मत क्योंकि यहाँ पे शुरू हो रहा है इंपल्स जो पेस, मतलब कुछ तो शुरू हो रहा है यहाँ पे पेस मेकर. यहाँ से हमको इंपल्स तैयार होके पूरा हार्ट की तरफ जा रहा है. अम्मा ఈ ప్లేస్ లో ఏం తయారవుతుందమ్మా? మనకి ఇంపల్స్ అనేది తయారవుతుంది. ఏమవుతుందమ్మా? ఇంపల్స్. అందుకే దీన్ని పేస్ మేకర్ ఆఫ్ హార్ట్ అని పిలుస్తాం. ఏమని పిలుస్తాం?
Pacemaker of heart.
Now what is the pacemaker of heart? Sinoatrial node. What is the pacemaker of heart?
Sinoatrial node.
What is the sinoatrial node?
Pacemaker of heart.
Nothing but where the impulse is starting. Where the impulse is
started.
where the impulse is
Started.
do you get my point?
Yes, sir.
Do you get my point?
Yes, sir.
Now, if impulse is started here, how the impulse is carried out to entire myocardium? Well, kada? Impulse has to travel, yes or no?
Yes,
So, from sinoatrial node, there is a pathway which is called as internodal pathway. There is a pathway which is called as
Internodal pathway.
from internodal pathway, it reaches to atrioventricular node. It reaches to
Atrioventricular node.
because this point is between the ventricle and atrium. You are saying it as atrioventricular node. You are saying it as
Atrioventricular node.
Am I clear?
Yes, sir.
Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
Yeah. Yesterday I told you to learn about the internal structure of the heart.
Yes, sir.
Yes or no?
Yes, sir.
Now, if you can see here, in internal structure of the heart, there are special fibers which are called as Purkinje fibers or Purkinje fibers. Yes or no?
Yes, sir.
Yes or no? Have you ever imagined what is these fibers? So they are nothing but they are carrying the impulses. They are nothing but they are carrying what, ma?
Impulses.
I'm going to go to first two pictures, blue color pictures. So when you look at the muscle, when you look at the cardiac muscle, especially myocardium, which is full with Purkinje fibers, so this is how the Purkinje fibers will look like in your heart. We can clearly differentiate between the heart muscle cell and Purkinje fiber. Next picture can tell. So you can see here clear image. So whatever the brighter part which you are seeing, these are nothing but the Purkinje or Purkinje. Do you get my point? Do you get my point? Where these are present? These are present in the heart muscle, especially
Myocardium.
Now, how the impulse is carried out to the entire heart means these particular fibers. Do you get my point? Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
Yeah, please, next. Now, we'll see. What is the sinoatrial node? I've told you, it is the pacemaker of the heart. It is the pacemaker of the heart. Now look into your textbooks. Look into your textbooks. Here, sinoatrial. What is the location? Sinoatrial node is situated on the posterior aspect of the heart. Which aspect of the heart?
Posterior aspect of the heart.
Posterior.
Aspect of the heart.
Now we have discussed about the regions of the heart and we have discussed about the positions of the heart. Now anteriorly, when you take the apex of the heart, so right ventricle is forming the apex of the heart mostly. Yes or no? Now base of the heart is formed by left atrium and small portion of right atrium. Yes or no?
Yes, sir.
Now at the base only in right atrium the superior vena cava is coming and inferior vena cava. Now here when you look at the location of the sinoatrial node, sinoatrial node is situated on the posterior aspect of the heart at the junction of superior vena cava with right atrium. At the junction of superior vena cava at the right atrium. Now this is right atrium. Am I clear?
Yes, sir.
This is what?
Right atrium.
Superior vena cava. So superior vena cava is posterior side or anterior side? Posterior
Side.
Yes or no?
Yes,
Now
sir.
superior vena cava openings are present at the base or the lateral side? Base, yes or no?
Yes, sir.
Now base is at the posterior. That means where the impulse is produced beneath the superior vena cava. That means the junction between the atrium and superior vena cava. Yes or no?
Yes, sir.
समझ में आ रहा है तुमको? सुनो, यहाँ पे राइट एट्रियम है और यहाँ से क्या हो रहा है? यहाँ पे क्या आ रहा है? यहाँ से सुपीरियर वेना कैवा। जब ये सुपीरियर वेना कैवा राइट एट्रियम ये दोनों एक जगह पे मीट हो रहा है, एक जगह पे फ्यूज हो रहा है कि नहीं? सो इस जगह पे हमको सुपीरियर वेना क्या हुआ और एट्रियल, इस जगह पे एक नोड आ रहा है, इसको हम क्या कहते हैं, साइनो एट्रियल नोड। इसको हम क्या कहते हैं, साइनो एट्रियल नोड। और यहाँ पे हार्ट का जो इंपल्स है यहाँ पे शुरू हो रहा है, पहला इंपल्स। क्या मां, पहला అర్థం తల్లి, మనకి ఏట్రియం ఉంది, పైనుంచి ఏమొస్తుంది, సుపీరియర్ వెనా క్యావా వస్తుంది, ఇది ఈ పోస్టీరియర్ సైడ్ ఉంది మనకి, ఇదే కదా బేస్ ఆఫ్ ది హార్ట్ ఫామ్ చేసేది, అవునా కదా, అవునా కదా. సో ఇక్కడ ఈ సుపీరియర్ వెనా క్యావా మరియు ఈ రైట్ ఏట్రియం, ఈ రెండు జంక్షన్ అయ్యే దగ్గర, అంటే జస్ట్ సుపీరియర్ వెనా క్యావా కింద మనకి సైనో ఏట్రియల్ నోడ్ అనేది ఉన్నది. సో what is the pacemaker of the heart అంటే ఏం చెప్పాలి,
Sino-atrial node.
ఏం చెప్పాలి,
Sino-atrial node.
ఏం చెప్పాలి,
Sino-atrial node.
what is the location of sinoatrial node అంటే posterior side of the heart between the superior vena cava and right atrium. Junction of superior vena cava and
Right atrium.
junction of superior vena cava and
Right atrium.
अदेना ఉందా మీ టెక్స్ట్ బుక్ లో सेपरेट के मन रासेड़ा, वही था ना टेक्स्ट बुक में, और अलग कुछ लिखा वहां पे नहीं है ना. अब समझ में आया, व्हाट इज द पेसमेकर ऑफ द हार्ट, hey what is the pacemaker of the heart, sino. Now look at this. So because the SA node discharge the rate, because the SA node discharge rate is faster than any other part of the heart, it normally sets the heart rate and it is called as the natural pacemaker of the heart. It is called what ma,
Natural pacemaker of the heart.
so there are, if you can see here, there is other node also, atrioventricular node. Why not atrioventricular node is called as pacemaker, why only sinoatrial node is called as pacemaker?
Because impulse start.
You get my point? Why not AV node is not called as pacemaker? Why only sinoatrial node is called as pacemaker? ఎందుకని sinoatrial node ने pacemaker అని పిలుస్తున్నారు, atrioventricular node ని ఎందుకని పిలవట్లేదు? क्यों हम sinoatrial node को pacemaker कहते, क्यों इसको नहीं कहते, atrioventricular node को क्यों नहीं कहते? बात है कि यहाँ पे जो साइनोएट्रियल नोड है, इसका इंपल्स जो है, इनकी तरफ से हम कंपेयर करेगा तो ये थोड़ी तेज रहते, क्या रहते, तेज रहते, लेकिन ये थोड़ी कम रहते. దీంతో పోల్చుకుంటే ఇక్కడ ఇంపల్స్ అనేది ఫాస్ట్ గా ఉంటదమ్మా, ఎలా ఉంటదమ్మా, ఫాస్ట్. సో దిస్ ఇస్ when you compare the AV node and sinoatrial node produces rate, discharge rate is faster when compared to other nodes, when compared to other nodes. And what is the another part here, here it normally sets the heart rate. So यहाँ पे हमारा हार्ट रेट जो आ रहा है वो 72 बीट्स आते हैं, कभी कभी 80 बीट्स आते हैं, कभी 90 बीट्स आते हैं, కొన్ని సార్లు 80 వస్తది, కొన్ని సార్లు 70 వస్తది, కొన్ని సార్లు 60 వస్తది, అవునా కదా, yes or no,
Yes sir.
how this how sometimes it is like 60, sometimes it is like 72, sometimes it is like 80, sometimes it is like 110, sometimes it is like 140 also. What is setting the pace here? कौन डिसाइड कर रहा है यहाँ पे पेस, कौन डिसाइड कर रहा है यहाँ पे रेट, हार्ट रेट ఎవరమ్మా నిర్ణయించిందంటే సైనోఏట్రియల్ నోడ్. ఎవరు నిర్ణయిస్తున్నారమ్మా,
Sino-atrial node.
సో ఇక్కడ ఇంపల్స్ ఎలా ప్రొడ్యూస్ అయితే हार्ट की మొత్తం ఇంపల్స్ అలాగా క్యారీ అవుతుంది. यहाँ पे कैसे निकलाते, सेम वही तरह से पूरा हार्ट को इंपल्स ट्रांसफर हो रहा है, उतना वही तेज में पूरा हार्ट कॉन्ट्रैक्शन होते है, అదే స్పీడ్ లో హార్ట్ కూడా మొత్తం ఏమవుతుందమ్మా, కాంట్రాక్ట్. समझ में आ रहा है ना, समझ में आ रहा है ना, yes or no. अब सुनो, the rate of impulse is generated by SA node. यहाँ पे जो SA node से रेट जो आ रहा है वो 60 to 100 रहते हैं, 60 to 100. So the rate which we are, the rate the heartbeat is there, it is decided by the SA node. Generally it is between 60 to 100 beats per minute, 60 to 100 beats per minute. Am I clear?
Yes sir.
Am I clear?
Yes sir.
Am I clear?
Yes sir.
Yes or no?
Yes sir.
Now what is the rate which is produced at sinoatrial node?
60 to 100.
60 to
100.
60 to
100.
What is the pacemaker of the heart? साइनो कभी कोई कोई आके आपको पूछेगा तो पेस में मतलब हार्ट जो कॉन्ट्रैक्ट हो रहा है ना कहां से पूरा तुमको इंपल्स मिल रहा है पूछेगा तो क्या बोलते हैं हाँ एक जगह है एक राइट एट्रियम और सुपीरियर वेना कावा का बीच में एक जगह है वहां पे एक नोड रहते हैं जिसको हम साइनो एट्रियल नोड कहते हैं वहां पे हमारा हार्ट की इंपल्स शुरू हो रहा है समझ में आया అర్థమైందమ్మా వినండమ్మా ఇప్పుడు మనల్ని ఎవరైనా వచ్చి హార్ట్ కొట్టుకుంటుంది కదా హార్ట్ కొట్టుకుంటున్న అలా కాంట్రాక్ట్ అవడానికి అలా కొట్టుకోవడానికి కరెంట్ ఎక్కడి నుంచి ప్రొడ్యూస్ అవుతుందని అడిగితే మీరు ఏం చెప్పాలి మనకి ఒక జంక్షన్ ఉంది అది రైట్ ఏట్రియం లో ఉంటది సుపీరియర్ వెనా కావాకి రైట్ ఏట్రియం దగ్గర ఒక నోడ్ వస్తుంది ఆ నోడ్ పేరు సైనో ఏట్రియల్ నోడ్ ఆ నోడ్ పేరు ఏంటి సైనో ఏట్రియల్ నోడ్ జనరల్ గా ఇంకా వేరే నోడ్స్ కూడా ఉన్నాయి కానీ ఈ సైనో ఏట్రియల్ నోడ్ అనేది ప్రత్యేకమైంది ఇక్కడే ఫస్ట్ ఇంపల్స్ స్టార్ట్ అవుతుంది ఇది వేరే నోడ్స్ తో పోల్చుకుంటే ఎక్కువ ఇంపల్స్ ప్రొడ్యూస్ చేస్తుంది ఏం చేస్తామా ఎక్కువ ఇంపల్స్ ప్రొడ్యూస్ చేస్తుంది దీని రేట్ ఎంత ఉంటుంది 62 అండ్ మన హార్ట్ రేట్ ఎవరు డిసైడ్ చేస్తారంటే సైనో ఏట్రియల్ నోడ్ do you get my point yes sir am I clear yes sir am I clear yes sir now listen to me okay node is produced at the sinoatrial node impulse is produced at the sinoatrial node now what has to be done it has to be carried out through the heart it has to be carried out through the heart yes or no yes. So from sinoatrial node it goes to a particular space which is called as atrioventricular node it goes to a particular space which is called as atrioventricular node from SA node to where it is coming atrioventricular node now the question is अभी हमारा चैलेंज क्या है बोलेगा तो यहाँ पे कहीं से आ रहा है how it is brought वहां पे शुरू हो रहा है वो तो ठीक सही बात है लेकिन ఏబి నోడ్ కి తర కైసే आ रहा है అక్కడ మొదలవుతుంది బానే ఉంది మరి ఏబి నోడ్ దగ్గరికి ఎలా వస్తుంది ఎలా వస్తుందమ్మా వెరీ సో ఇక్కడ మనకి ఎస్ఏ నోడ్ నుంచి ఏబి నోడ్ కి తీసుకొచ్చింది ఏంటంటే ఇంటర్ నోడల్ పాత్వే ఏంటమ్మా ఇంటర్ నోడల్ పాత్వే సో విల్ డిస్కస్ అబౌట్ దిస్ ఇంటర్ నోడల్ పాత్వే we'll discuss about this internodal pathway so it is also called as internodal fibers the name पिलुस्तुन्नामा internodal fibers क्या कहते हैं इसको internodal fibers internodal fibers अब तो ठीक है ना अब तक ठीक है ना अब सुनो क्या हो रहा है यहाँ पे bands and fibers connecting SA node to AB node are called as internodal fibers यहाँ पे क्या कनेक्ट कर रहे हैं bands of fibers bands of fibers इसको हम क्या कहते हैं internodal fibers क्या कहते हैं इसको internodal fibers they conduct impulses from sinoatrial node to the atrioventricular node by arranging themselves in three bundles by arranging themselves in three bundles एसए नोड से एबी नोड की तरह इंटरनोडल पाथवे बोल के एक पाथवे रहते हैं ये पाथवे में हम इसको क्या कहते हैं मतलब इंटरनोडल फाइबर्स कहते हैं ఇంటర్నోడ్ ఇక్కడ మనకి ఎస్ఏ నోడ్ నుంచి ఏబి నోడ్ రావడానికి ఇంటర్నోడల్ పాత్వే అనేది ఒకటి ఉంది ఆ ఇంటర్నోడల్ పాత్వేలో ఏముంటాయంటే ఇంటర్నోడల్ ఫైబర్స్ ఉంటాయి ఆ ఫైబర్స్ మనకి మూడు రకాలుగా విభజించబడ్డాయి హౌ మెనీ టైప్స్ మా 3 टाइप्स సో यहाँ पे यहाँ तक जो लेके आ रहा है इसको हम क्या कहते हैं इंटरनोडल फाइबर्स कहते हैं अब तक तो बात ठीक है लेकिन वो फाइबर्स कैसे कौन है वो बोलेगा तो वो तीन रहते हैं कितने रहते हैं तीन रहते हैं वो तीन क्या आप देखते हैं सुनो पहले वाले को हम एंटीरियर इंटरनोडल ट्रैक्ट ऑफ बैकमैन पहले क्या है एंटीरियर इंटरनोडल ट्रैक्ट ऑफ बैकमैन anterior internodal tract of बैकमैन और सेकंड क्या है मिडिल इंटरनोडल ट्रैक्ट ऑफ वैटी बैक मिडिल इंटरनोडल ट्रैक्ट ऑफ वैटी बैक वैटी बैक एंड पोस्टीरियर इंटरनोडल ट्रैक्ट ऑफ थोरल posterior internodal tract of Now you have to think here. He is saying anterior, he is saying middle, he is saying
Posterior.
that means impulse has to be transmitted posterior to the heart, anterior to the heart, and middle also. So how it is carried out? It is carried out by internodal pathway. This internodal pathway consists of internodal fibers. Anteriorly, fibers are called as internodal tract of Bachmann. Middle internodal fibers are called as middle internodal tract of Van Bach, and posterior internodal tract of Thorel. Posterior internodal tract of. Now, how many types of internodal fibers are there? First one is anterior, second one is middle, third one is posterior. Do you get my point? Yes or no? So these are the internodal pathways which bring the impulse from sinoatrial node to atrioventricular node. They are bringing to atrioventricular node. Am I clear? Am I clear? Yes or no? So from sinoatrial node, where the impulse is brought? Who brought? What is there in internodal pathway? How many fibers are there? What are the three fibers? Anterior. What is the anterior called as? Amma? What ma? What is the middle called as? Vacant. What is the inferior called as? Thorel. What is the inferior called as? Now you know what are the fibers which are present between AV node and SA node. Yes or no? Yes or no? Now we have to think about AV node. We have to think about AV node. Now what is this AV node? AV node is situated just beneath the endocardium on the right side of the interatrial septum near the tricuspid valve. Where it is located? Near the tricuspid valve. It is located in the left side of the heart or right side of the heart? AV node is located in the right side of the heart. Where it is located, in atrium or ventricle? It is located near the atrium, near the tricuspid valve. In the atrium, near the tricuspid valve. Near the tricuspid valve. What is this tricuspid valve? What is this tricuspid? It allows the cardiac right atrium blood to open into right? Yes or no? Yes or no? So we know the situation of atrioventricular node. Am I clear? Am I clear? Yes or no? Yes or no? Now it is there just beneath the endocardium. It is there just beneath the endocardium. Endocardium is there just beneath to the endocardium. This AV node is present. What is the endocardium means? It is the middle layer or inner layer? Inner layer of the heart. So there is an inner layer which is called as endothelium. Just beneath the endothelium. Who is there beneath the endothelium? What are the layers of the heart? What is the first layer? What is the second layer? What is the third layer? So endocardium is inner means beneath the endocardium who will be there? Myocardium. Yes or no? So just beneath the endocardium is saying means above the myocardium AV node is present. Yes or no? Yes or no? In between the myocardium and endocardium, just beneath the endocardium is saying that means AV node is present. Am I clear? Am I clear? Yes or no?
Yes sir.
समझ में आ रहा है ना?
Yes.
आपको? हाँ सुनो. Listen carefully. Now, it is the only conducting pathway between the atria and ventricles. Between the atria and ventricles. देखो, AV नोड से किधर जा रहा है बोलेगा तो AV नोड से पूरा वेंट्रिकल की तरफ से जा रहा है. इंपल्स जो शुरू हुआ कहां पे शुरू हुआ? राइट एट्रियम पे शुरू हुआ. राइट एट्रियम से कहां जा रहा है? तो राइट एट्रियम पे रहते हैं. और दूसरी जगह क्या है यहाँ पे? एट्रियोवेंट्रिकुलर नोड. क्या है यहाँ पे? एट्रियोवेंट्रिकुलर नोड. अब ये एट्रियोवेंट्रिकुलर नोट्स ये क्या कह रहा है हम उसको एट्रियो वेंट्रिकल सो मतलब यहाँ पे एट्रियम इन्वॉल्व है वेंट्रिकल्स भी
इन्वॉल्व है
यस और नो
यस सर
सो यहाँ से किधर जा रहा है एट्रियम और वेंट्रिकल so that is the only pathway between the atria and ventricle. Next one, the rate of impulse generated by AV node is just like SA node but a lower rate of 640 to 60 per minute. Okay, listen to me carefully. SA node is why SA node is called as pacemaker of heart means the rate is higher when compared to AV node. The rate is higher when compared to
AV node.
Now SA node is also producing impulse. Same way, AV node also will produce impulse, but the rate is low when compared to sinoatrial node. The rate is low when compared to
Sinoatrial node.
Am I clear?
Yes sir.
Am I clear?
Yes sir.
Yes or no?
Yes sir.
Yes or no?
Yes sir.
Okay. So, what is the rate of SA node there?
60 to 100.
60 to
100.
What is the rate of AV node here?
40 to 60.
40 to
60.
40 to
60.
Now, SA node also will generate impulse. Same way, AV node also will generate impulse. But the difference is the rate of SA node is higher than the rate of
AV node.
AV node. The rate of SA node is higher than the rate of
AV node.
AV.
Node.
Am I clear?
Yes sir.
Am I clear?
Yes, sir.
Yeah. There is another point here. You just look at it. So impulse from AV nodes takes about 0.08 to 0.1 second for its transformation to bundle of His. The delay is called as AV nodal delay. The delay is called as
AV nodal delay.
What is this AV nodal delay? What is the difference with 0.08 seconds to 0.1 second? That is where your cardiac cycle will act. That is where your cardiac cycle will come into play. That is where your cardiac cycle will come into play. Now, if the atrium and ventricle are contracted together, where the blood will go? So, simultaneously, when atrium contracts, the ventricle has to relax. When ventricles contracts, the atrium has to relax. That is the point where the chambers are being filled. When relaxed, the chambers are filled with blood. When contracted, the chambers are emptied with the blood. Do you get my point? When atrium contract, the blood is emptied into the ventricles. When atrium relax, the blood is coming from superior vena cava and the pulmonary veins. Do you get my point? Superior vena cava and superior vena cava, inferior vena cava, coronary sinus open into right atrium, pulmonary veins open into left atrium. You get my point? So this particular delay is called as AV nodal delay. This delay is called as what, ma?
AV nodal delay.
Am I clear? Am I clear?
Yes, sir.
समझ में आ रहा है ना? हमारा అర్థమవుతుందా లేదా? నిద్రపోకుండా లైట్ లేవు కదా అని చెప్పి ఏంటి ఓకేనా? క్లాస్ బోరింగ్ గా ఉందా? క్లాస్ బోరింగ్ గా ఉందా? మన హార్ట్ కోసమే మాట్లాడుకుంటున్నాం. దేనికోసం మాట్లాడుకుంటున్నాం? ఉందా హార్ట్? ఉందా? ఉందా లేదా? ఉందా? నేను లేదనుకుంటున్నాను. ఎవరికైనా ఇస్తారా? किसी को दिया और तुम्हारा तरफ है तुम्हारा हार्ट तुम्हारा पास है, किसी को नहीं दिया, ठीक है, अच्छी बात है, रख लो ऐसा. Now from EV node where the transmission is done, the transmission is done to the bundle of His. The transmission is done to the
Bundle of His.
Exactly. What is this bundle of His? Look at the diagram. Look at the diagram. Now, atrium. Yes or no?
Yes,
atrium and
Atrium.
we are clear. We are clear. Now, to the ventricles. So, in between the ventricles, here, where the ventricular. So, where if you can see between the ventricles, you call this junction as atrioventricular junction అంటే ఏంటి? Between the atrium and ventricle. Yes or no? Yes or no? చూడండి. ఏంటమ్మది? Interventricular. It is called as interventricular. సో ఈ ఇంటర్వెంట్రికులర్ జంక్షన్ ఇది ఎక్కడికి వెళ్తుందంటే బండిల్ ఆఫ్ హిస్ ఎక్కడికమ్మా
Bundle of his.
నౌ దిస్ ఈస్ కాల్డ్ as బండిల్ ఆఫ్ హిస్ దిస్ ఈస్ కాల్డ్ as
Bundle of his.
దిస్ ఈస్ కాల్డ్ as
Bundle of his.
సో ఇక్కడ చూడండి ఇక్కడ ఏట్రియోవెంట్రికులర్ బండిల్ ఐఎమ్ సారీ atrioventricular bundle between the atriums and ventricles, between the atriums and ventricles. So impulse has to pass. Okay, am I clear?
Yes, sir.
I think I just confused you. Just we'll go on. You will understand. Okay, just come. Okay, it is the only conducting pathway between the atria and ventricles. So from atrium to ventricles, this AV node is playing a major role. Next one. Impulse from AV nodes takes about 0.8 to 0.1 second. We have completed. For its transmission to bundle of his, where it is coming to bundle of his. Next, the delay provides enough time for. Why the delay is there? I've already told you. It provides enough time for emptying of blood from atria into the ventricle, so the effective pumping is done. So that the effective pumping is done. So when the delay is occurring, what is happening? The atrium are contracting completely and the ventricles are stayed and relaxed, so that the blood which is there in the atrium is completely filled into the ventricle. Is completely filled into the ventricle. Am I clear?
Yes, sir.
Now, AV nodal delay is shortened by the sympathetic stimulation and lengthened by the stimulation of parasympathetic fibers of vagus. So when we are discussing about nervous system, there is autonomous nervous system, which we have parasympathetic and sympathetic nervous systems. I'll clearly explain you when we are discussing about nervous system. Now this sympathetic nervous system, what it is doing, this sympathetic nervous system, what it is doing means it is shortening the time period. It is shortening the time period. What is this parasympathetic system is doing means it is lengthening the time period. It is lengthening the time. Do you get my point? So sympathetic, what it will do? It will shorten the time. Parasympathetic enlarge, lengthens the time. Am I clear? Yes, sir. Now we have to discuss the fourth thing, which is called as bundle of his. Which is called as
Bundle of his.
Which is called as
Bundle of his.
Now, this bundle of is exactly located between the atrium and ventricles. Exactly located between the atriums and
Ventricles.
atrium and you
Ventricles.
can see here. That's why this is named as atrioventricular bundle. This is called as
Atrioventricular bundle.
otherwise known as
Bundle of his.
otherwise known as
Bundle of his.
otherwise known as
Bundle of his.
Am I clear? Am I clear? Now, what is this bundle of his? Okay, we'll look one by one. Okay, just see. Bundle of his is located beneath the endocardium on the right side of interventricular septum. On the right side of
Interventricular septum.
it begins at the atrioventricular node and crosses the AV ring and descends along the posterior inferior border of the membranous part of ventricular septum. Now listen to me. So here ventricular septum means this part is called as ventricular septum. This part is called as
Ventricular septum.
Now ventricles are separated by
Interventricular
interventricular septum. Ventricles are separated by interventricular septum. Now if you can see here, these are the two atriums. These are the
two atriums.
So from atrioventricular junction, there is a ring which is called as atrioventricular ring, which separates both the atrium, which separates both the ventricles. Now it is passing through both the AV ring. It is passing through the atrioventricular ring and here divided as two branches. And divided as
Two branches.
so it is passing posterior side of the heart. It is passing
Posterior side of the heart.
we know what is the anterior side of the heart, what is the posterior side. So it is passing through posterior side of the heart in between the interventricular septum. In between the
Interventricular septum.
Now what is this interventricular septum is doing? It is separating right ventricle from the left ventricle. Am I clear? Am I clear? Now, this bundle of is divided into branches, which will go right bundle branch and left
bundle branch.
which will go as right bundle branch and left.
Bundle branch.
Now, right side bundle branch is taking the impulse to right ventricle, left side bundle branch is taking the impulse to left. Am I clear?
Yes, sir.
Am I clear?
Yes, sir.
Am I clear?
Yes, sir.
Yeah, please listen to me. Now, what is this bundle? It begins as the atrioventricular node. It begins as the atrioventricular node and crosses AV ring and descends along the posterior inferior border. Descends along the posterior
inferior border.
posterior side of the heart. This back. Inka vellu. So this is the posterior. Now posterior ante back of the heart, inferior ante down towards the heart. Posterior ante entamma back of the heart, inferior means down towards. So anterior view తీసుకెళ్ళాలి. This is the anterior view. But the impulse is generated in the right atrium, posterior back side of the heart. Where it is generated? Again, the AV node also towards the posterior side only, not towards the anterior side. It is also towards the posterior. Again, to the bundle of is also, it is going from posterior side of the heart. It is going from
Posterior side of the heart.
It is passing the atrioventricular node and is divided into two types: left bundle branch and right bundle branch. They are passing in between the interventricular septums. They are passing in between the
Interventricular septums.
Am I clear?
Yes, sir.
Am I clear? हेलो मैडम, समझ में आ रहा है? सो रहा है? हाँ? इधर देखो, समझ में आ रहा है कि नहीं? नींद आ रहा है? अमन द्रस ना करना? You go and wash your face. You. तुम नहीं यार, तुम्हारा पीछे. हाँ. अरे जाओ जी. आप नहीं. हाँ. हाँ? ठीक है, इस टाइम मैं फोटो खींच लेके सबको दिखाता हूँ. हाँ? अगर अगली बार हम देखेगा तो सीधा फोटो निकालते सबको दिखाते हैं. यस और नो? हेलो, किधर जा रहा है? हेलो, नींद आ रहा है? फिर बैठो. अगर नींद आ रहा है तो आप जाओ, नहीं तो बैठो. Now listen carefully. So, So at the upper border of the muscular part of septum, it divides into right and left branch. Amma, a picture తీసుకోవచ్చు. మన picture, main picture తీసుకోవచ్చు. So at the upper part of the muscular border, it is dividing into two. One is right, another one is right and another one is left. Next, the rate of impulse generated by bundle of is 30 to 40 per minute. 30 to 40 per minute. What is the rate which is generated at SA node?
60 to 100.
60 to
100.
What is the rate generated at AV node?
40 to 60.
What is the rate generated at bundle of is?
30 to 40.
30 to
40.
That means bundle of is also has some impulse generating power. But the rate is low. Approximately 30 to 40. Now, the speed of conduction in the bundle of is about 1 millisecond. Okay, next. Right branch of AV bundle passes down the right side of the interventricular septum. A large part enters into the moderator band to reach the anterior wall of right ventricle, which divides into Purkinje fibers. Now see, when you take the right side, When you take the
Right side.
Now the bundle of is passing through the anterior side also. Yes or no? It is making sure that the entire right ventricle is supplied by the Purkinje fiber. It is making sure that the entire right ventricle is having the conduction of impulse. Similarly, the left side also you can see. Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
Yeah, here the left bundle branch of AV node descends left side of the interventricular septum. Now it is towards the right side or left side?
Left side.
Slightly moving towards the left side of the interventricular septum. So this is interventricular septum. See, right side of the bundle, right bundle of his branch is to the right side, left is towards the
Left side.
But here it is in the middle. At the upper part it is in the middle, but when the bundle of this is divided into two branches, right bundle branch is going to right side, left bundle branch is going to left side, but they are still in the interventricular
Septum.
Am I clear?
Yes.
Now, clear. So, interventricular and it is distributed to the left ventricular septum. Left ventricular septum dividing into Purkinje fibers. Dividing into
Purkinje fibers.
Dividing into
Purkinje fibers.
Am I clear?
Yes, sir.
Am I clear?
Yes, sir.
Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
Now, exactly we have to discuss what are these Purkinje fibers or Purkinje fibers. Am I clear?
Yes, sir.
Okay. See, we'll see. Any doubt?
Purkinje fibers in-
अभी बोल रहा हूँ अब तक खत्म नहीं अभी शुरू हो रहा है Purkinje fibers अब तक हम क्या देखा एसए नोड कहाँ पे शुरू होते हैं कैसे शुरू होते देखा एसए नोड से एबी नोड की तरह वो इंपल्स कैसे निकला रहा है देखा यस और नो व्हाट यू कॉल इट एज इंटरनोडल पाथवे सो इंटरनोडल पाथवे के बारे में देखा कितने रहते बोलेगा तो 3 रहते फिर हम क्या क्या किसमें देखा एट्रियो वेंट्रिकुलर नोड वो भी हो गया फिर हम कौन क्या देखा बंडल ऑफ इसका बारे में और क्या पढ़ा किया एक राइट रहते एक लेफ्ट रहते ये ऊपर शुरू होते मस्कुलर रिंग के सामने और यहाँ पे दो की तरह डिवाइड हो रहा है एक तो राइट साइड जा रहा है और एक तो लेफ्ट साइड आ रहा है अब तो ठीक है अभी बंडल ऑफ इस जो है वो कैसे हो रहा है तो Purkinje fibers और Purkinje it is dividing into Purkinje और so మనం మాట్లాడుకున్నాం కదమ్మా మరి చెప్పాలా అర్థమైందా చెప్పాలా అర్థమైంది కదా ఏబీ నోడ్ దగ్గర ఎస్ఏ నోడ్ దగ్గర స్టార్ట్ అయింది ఏబీ నోడ్ దగ్గరికి వచ్చింది ఎలా వచ్చిందంటే ఇంటర్నోడల్ పాత్వే ద్వారా వచ్చింది ఇంటర్నోడల్ పాత్వే ద్వారా ఏబీ నోడ్కి వచ్చిన తర్వాత ఏబీ నోడ్ నుంచి బండిల్ ఆఫ్ తీసుకొచ్చింది బండిల్ ఆఫ్ తీసుకొచ్చిన తర్వాత ఎలా డివైడ్ అంటే రైట్ బండిల్ ఆఫ్ ఇస్ రాఫ్టర్ బండిల్ సో ఈ బండిల్ ఆఫ్ ఇస్ అనేది ఇంటర్వెంట్రికులర్ సెప్టమ్ లో ఉంది రైట్ ఇంటర్వెంట్రికులర్ సెప్టమ్ లెఫ్ట్ ఇంటర్వెంట్రికులర్ సో ఇప్పుడు ఈ వెంట్రికులర్ సెప్టమ్ నుంచి మనకి ఎక్కడికి వెళ్ళాలి మజిల్స్ కి వెళ్ళాలి మొత్తం హార్ట్ కి అంతా స్ప్రెడ్ అవ్వాలి అలా ఎలా స్ప్రెడ్ అవుతుందంటే స్పెషల్ ఫైబర్స్ ఉన్నాయి వాటిని Purkinje ఫైబర్స్ ఆర్ Purkinje ఫైబర్స్ సో టూ టైప్స్ అన్నమాట Purkinje ఫైబర్స్ సో ఈ Purkinje ఫైబర్స్ అంటే ఏంటి ఇవి ఎలా డిస్ట్రిబ్యూట్ అయినాయి చదువుదాం ఓకే we have to discuss about the Purkinje fibers listen Purkinje fibers arise from the branches of bundle of his they are arising from the branches of
Bundle of his.
now where the bundle of his is located interventricular septum now these small structures which came out as branches these small structures which came out as branches are called as Purkinje fibers are called as what one Purkinje
fibers
they branch extensively and run subendocardially they run subendocardially they are fast conducting which conduct impulse at the rate of 4 m per second ఒకసారి దిగుతారు 1 second No, please put off the fan. Put off. No. Yeah, please listen. I had a bit confusion. That's the reason I have taken small break. Okay. Yeah. So we are talking about Purkinje fibers. We are talking about Purkinje. So when we are talking about Purkinje fibers, they are fast conducting. What ma? They are fast conducting, and the impulse rate is about 4 meters per second. Impulse rate is about
4 meters per second.
What is the impulse rate? 4 meters per
second.
So the fast conduction helps in the instantaneous spread of impulse to the both right and left ventricle so that they contract simultaneously. Now listen to me carefully. Listen to me carefully. So we were discussing about the conducting system of the heart. Am I clear? Yes or no?
Yes,
So in conducting system of the heart, we have seen where the actual impulse starts. We have seen where the actual impulse starts. So the impulse is starting at a special node which is called as sinoatrial node. A special node which is called as
Sinoatrial node.
and followed by the impulse is carried out to atrioventricular node through internodal pathway. Through what ma?
Internodal pathway.
So that was clear. From internodal pathway, it is going to atrioventricular node. From in every node, it is going to the bundle of His, and this bundle of His is divided into left bundle of His and right bundle of His. So these left and right bundles are further divided into special structures which are called as Purkinje fibers. Which are called as Purkinje fibers. What are these Purkinje fibers? They are spread throughout the ventricle. They are spread throughout the ventricles, and their conduction rate is very fast. It's approximately 4 meters per second. The conduction rate is very fast, and approximately it is 4 meters per second. Now, why the rate has to be that much speed means why the rate has to be that much speed? उतना तेज में क्यों रहना है बोलेगा तो एक ही समय में दोनों वेंट्रिकल कॉन्ट्रैक्ट होना है. ఒక్కసారి వెంట్రికల్స్ రెండు కూడా కాంट्रैक्ट. अगर Purkinje फाइबर्स में रेट उतना तेज नहीं है तो राइट वेंट्रिकल एक टाइम पे कॉन्ट्रैक्ट होते हैं, लेफ्ट वेंट्रिकल और एक टाइम पे कॉन्ट्रैक्ट होते हैं. तब कार्डियक साइकिल पूरा कंप्लीट होते हैं. ఒకసారి ఇప్పుడు కొంచెం ఎక్కువ ఇంపల్స్ రైట్ సైడ్ వచ్చేసి తక్కువ ఇంపల్స్ లెఫ్ట్ సైడ్ వెళ్ళినా, తక్కువ ఇంపల్స్ లెఫ్ట్ సైడ్ వచ్చేసి ఎక్కువ ఇంపల్స్ రైట్ సైడ్ వచ్చినా కాంట్రాక్షన్ అంతా కరెక్ట్ గా జరుగుతుందా? Emptying of blood from ventricles is done. Simultaneously, both the ventricles has to contract. Simultaneously, both the atrium has to
Contract.
Do you get my point?
Yes, sir.
Yes or no?
Yes, sir.
So to make sure that the simultaneous contraction is happening, the special structures which are called as Purkinje fibers are present.
Present.
Do you get my point? Do you get my point?
Yes, sir.
Do you get my point?
Yes, sir.
Listen to me carefully. Now, the interventricular septum, the depolarization wave of electrical impulse spreads rapidly through the Purkinje fibers to all parts of the ventricles. The rate of impulse generated by the Purkinje fibers is 20 per minute. How many ma? 20 per minute. So Purkinje fibers are also producing a rate, a small kind of impulse, but the rate is very low. The rate is very
Low.
What is the rate of SA node?
60 to 100.
What is the rate of AB node?
40 to 60.
What is the rate of bundle of His?
30 to 40.
What is the rate of Purkinje fiber? 22 20 per minute. 20 per
minute.
20 beats per minute. Do you get my point? So this is the conducting system of the heart. This is the conducting system of the heart. Everybody knows now what is the conducting system of the heart?
Yes, sir.
Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
In next class, we'll see what is the origin and what is the spread of cardiac impulse. Okay, so you want a break or you want me to continue? You want a break? Yeah, take 5 minutes break and come fast. Okay, we'll start the new chapter again. What is the time now? 10? 10? Exactly, Chapanama. 10:20. Okay, take break until 10:30. Again, we'll start class at 10:30. Okay, go. Amma? అవునమ్మా.
Saturday में first chapter exam है.